Hello, 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 YouTube world. It's Miss Patty with 4YourCNA coming to you for our twice a month CNA practice test game show. Welcome. So happy to have you guys here. Good morning, Renee. Good morning, Lynn. Hi, Ashley. Hi, Taki. So nice to see you guys. Oops, let me bring my mic over a little bit closer. All right. Good morning. Good morning. Can everybody hear me? If you can hear me, give me a thumbs up or let me know in the chat. Good morning, Elander. Good morning, RA. Hi, guys. Everybody hear me good? Are you ready? Yes. Hey, Blue. you're my OG. Gipsy, hi. Elander, good. Okay, so everybody can hear me. Okay, let's get started. So this is our CNA practice test game show. And for those of you who have not attended this before, it is kind of a fun way of preparing for the written CNA state exam. So I'm going to present 15 test-like questions, and you guys are going to have a chance to compete for real prizes simply by answering the questions. Good morning, guys. So the way this works is I'm going to put a question on the screen with 4 answer choices, 1, 2, 3, and 4. You are going to put in your chat the number of the answer you want to pick. Don't put anything else. Don't put other words. Don't put symbols. Just the number. So if you want to choose number 1, just put number 1 and then hit send. Now, the program that I use actually sits on top of YouTube, and it reads those responses as they come in, and it awards points. The fastest correct answer gets the most points, so speed kind of counts here. If you get it wrong, no points. If you put anything else in there, it's not going to read it. So just the numbers 1, 2, 3, or 4. Okay? So today, the questions are going to come predominantly from I gotta change that. Hold on one second. Actually, no, this is so predominantly when I created these questions, I really kind of wanted a overview of all of the different types of questions that you would see on the state exam with all of the categories. So things like role of the nurse aide, promotion of function and health, basic nursing care, responding to changes, and safety. So you're going to see some questions out of every category today to kind of give you an idea of where your own strengths and weaknesses lie. But as I was writing them, I seemed to kind of default to this category, and that's really very common for me. I tend to go here because this is where students are most focused in their studying is, how, we're okay with our role, we're okay with normal everyday care. It's when patients have changes that CNAs get really anxious and not real sure how to answer these types of questions. So I always tend to default to this category, so I'm just going to leave that up there for now. But remember that today you're going to get questions from a lot of different topics. Okay, so prizes. Well, first place prize, you're going to get a t-shirt. And you've got a couple that you can choose from. You've got the 4YourCNA shirt. Good morning. You've got the 4YourCNA shirt. You've got Become, Inspire, Care with the CNA outline. You've got Called to Care. And you've got the CNA Care Crew. So figure out which one of those you might want as your number 1 prize for first place. Now, the class shirt, the one that, so I'm wearing, you can see it here. This is what we wear in class. It has the 4YourCNA logo on the front, and then on the back, we call it our cheat shirt, because on the back, you can see the 4YourCNA. You can see it there on the screen. All of our sayings are actually in the letters on the back. So, if you want the 4YourCNA cheat shirt, let us know whether you want that big graphic on the front or the back, okay? Some people like it on the front, some like it on the back. All right, so second place prizes. Second place is going to be the card game, which I have right here, the CNA Principles card game. This is a really fun way of studying. It goes over all of the principles you need to know, but you can also play it with people that aren't in healthcare as well. It's got a lot of strategy to it. It's a rummy style game. It's a lot of fun, and you can you can derail people pretty quick with specialty cards. So there's a lot of strategy to it, and it's a lot of fun. Third place is going to be some motivational gifts. You're going to get a badge holder, which you can see on the screen there. You're going to get a keychain, bracelet, just some motivational gifts to thank you for your contributions to healthcare. So those are the prizes. Each question is going to be on the screen for about 60 seconds. I'll read the question and the answer choices. You'll put into the chat the number of the choice you want to pick. Remember, faster right answer gets more points, but you don't get any points for wrong answers. Keep that in mind. So pick quick, but pick right. Only put the number in and then hit enter. If you put anything else in, my program probably won't read it. All right, so are we ready to get started? So Blue says, I find emergencies, urgent needs, dealing with family and family boundaries is really hard for the new HCA CNA. Yeah, those are very difficult concepts. And unfortunately, with most of those, it is not a one-size-fits-all approach. So a lot of that stuff you're not going to see on the state exam because it's going to be very targeted and individualized for, interactions. But that's a good topic for a future conversation, Blue. All right, so let's go ahead and get started. Limber up those fingers. Limber up those fingers. We've got about 25 seconds before we're going to get started. Okay, you guys ready? Everybody can hear me okay, right? Okay, here we go. Get a drink. All right, first question. What is the best way to prevent the spread of infection? 1, use proper hand hygiene. 2, wear gloves at all times. 3, wear face shields in patient rooms. Or 4, avoiding sick residents. What is the best way to prevent the spread of infection? 1, use proper hand hygiene. 2, wear gloves at all times. 3, wear face shield in patients' rooms. Or 4, avoiding sick residents. Go ahead and lock in your final answer. You've got about 20 seconds left. Go ahead and lock in your final answer. Okay. The right answer here, yeah, most of you guys got this one right. Right answer here is proper hand hygiene. Yeah, and this is going to mean that we wash our hands before every patient encounter. Before you touch the patient, you should have clean hands. And then we wash our hands at the end of every patient encounter. Before you leave the room, at the end of your skill, you have to wash your hands. Now, yes, we can use alcohol-based hand sanitizer if your facility allows that, but hand hygiene covers both hand washing and sanitizer. Proper hand hygiene is critical to prevent the spread of infection. Wearing gloves at all times does not do that. Neither does face shields. And we don't avoid sick residents. That's the whole reason we're there. All right. Renee came in first, followed by Christine, Danieka, and Blue. Good job. Good job. All right, question 2. A resident with dementia becomes agitated. What should the CNA do? 1, yell for help. 2, try to calm them and redirect them. 3, leave the room. Or 4, call security. So a resident with dementia becomes agitated. What should the CNA do? 1, yell for help. 2, try to calm and redirect them. 3, leave the room. Or 4, call security. Go ahead and lock in your final answer. Got about 20 seconds left. What do you think we should do here? Yeah, this is an easy one, I know. I know. I have to start you guys off easy. Okay, the right answer here is number 2. Yeah, we're going to calm them down and redirect them. And I actually talked about this a little bit in my class yesterday. It's super important to get their focus off of whatever is agitating them. So we can get them involved in an activity, ask them a question about their previous life, try to get them engaged in an activity or a conversation that has nothing to do with what agitated them. And that should help calm them down. Yelling for help, that's going to agitate them further. Leaving the room, we never leave an agitated person alone. And calling security isn't going to help you in this situation. It's our job to know how to respond to this properly. So Danyeka came in first, followed by Audrey, Renee, and Christine. I hope I'm saying those right. If I'm not, I'm so sorry. All right, question 3. What is the CNA's role during a fire emergency? 1, wait for instructions. 2, open all doors. 3, evacuate all residents. Or 4, follow race protocol. So what is the CNA's role during a fire emergency? 1, wait for instructions. 2, open all doors. 3, evacuate all residents. Or 4, follow race protocol. Go ahead and lock in your final answer. You've got about 20 seconds left. And I'm going to pause this after this question because I've got to explain something. All right. Oh, that's cool, Blue. Improv and acting class. Yeah, to help relate to patients. That's pretty cool. All right, your right answer here is number 4. Yeah, that's right. I know a lot of you picked number 3. So I'm going to pause this for just a second so I can talk about this. So I'm going to explain why each one of these is wrong. In a fire, you don't have time to wait for instructions. You have to act. There's just no time to wait. So acting is important here. Prompt action. Opening all the doors is actually opposite of what we need to do. Closing the doors is a fire safety action that we take because doors in a medical facility are fire rated, which means that it can help contain fire in a certain location. Evacuate all residents. That's not the right answer. And I know most of you put that, but it's actually not the right answer. And this is why during the exam, and I did this on purpose, you guys fell for it. You did perfect. But this is why during the exam, you need to read all 4 answers. Because most of you got to 3, it looked right, and you picked it. 3 is not the right answer. 4 is. We don't necessarily evacuate all residents. We're only going to evacuate the residents that are in the immediate vicinity of the fire. So 3 is not correct. 4, follow RACE protocol is. So RACE is RACE, which is rescue, alarm, contain, and extinguish. What that means is that we're going to remove the patients from the area of the fire. We're going to sound the alarm, let everybody know, hey, there is a fire. That may involve pulling your fire alarm. It may involve contacting the switchboard operator at your facility. Whatever your facility is, we have to call an alarm. Then we're going to contain. We're going to close those doors. And then if possible, we're going to try to extinguish that fire, put it out. But you have to follow those 4 steps in the right order. So that is a test question. Blue came in first on that one, followed by Neil, Yulander, and Tossing. Good job, guys. Okay. Number 4, which of the following is a part of the CNA's scope of practice? 1, administering insulin. 2, diagnosing illness. 3, assisting with ADLs. Or 4, prescribing medication. So yeah, I gave you an easy one after a hard one. I took some pity on you guys. Which of the following is part of the CNA's scope of practice? 1, administering insulin. 2, diagnosing illness. 3, assisting with ADLs. Or 4, prescribing medication. Go ahead and lock in your final answer. Please remember, you can't have anything other than the number in your answer. So you got about 10 seconds left. This one should be a super easy question for you guys. Super easy question. And the right answer here is yes, assisting with ADLs. That is what CNAs do. Nurses administer insulin. Doctors diagnose illness, and advanced healthcare practitioners prescribe medication, but CNAs assist with ADLs. We just help patients do what they would normally do for themselves if they were able to, but because of illness or injury or just lack of energy, they may need some help with that. So, yeah, I know, Blue, I know, but it's very, very important to understand that in some places, CNAs do administer insulin with additional training. Question has nothing to do with that. All right, Renee came in first, followed by Audrey, Danica, and Catherine. All right, so number 5, when documenting, the CNA should, 1, use only medical terminology. 2, chart facts and observations only. 3, record personal opinions. Or 4, skip minor details. So when documenting, the CNA should, 1, use only medical terminology. 2, chart facts and observations only. 3, record personal opinions. Or 4, skip minor details. Go ahead and lock in your final answer. You've got about 20 seconds left. 20 seconds. All right. I thought this one was going to trip up a few more of you. You guys are good. You're good. All right. The right answer here is number 2. We're going to chart facts and observations only. And a good rule of thumb when we're documenting with words in a patient chart is never use the word I. I saw, I felt, I think. You want to try to minimize the use of I because the focus is not on you. The focus is on the patient. The patient was found on the floor, not I think the patient fell. Observations and facts only. And it's really hard not to put your own personal spin on it, but this takes a little bit of practice with documentation. Good job, guys. Very good. All right. Renee came in first, followed by Audrey, Catherine, and Blue. Moving on, question 6. Which sign may indicate a urinary tract infection? 1, clear urine. 2, increased thirst. 3, weight gain. Or 4, urinary frequency or urgency. So which sign may indicate a urinary tract infection? 1, clear urine. 2, increased thirst. 3, weight gain. Or 4, urinary frequency or urgency. So you got about 20-ish seconds. Go ahead and lock in your final answer. And it's important that we know the signs here because this is what we're going to need to report to the nurse if we see unusual signs. All right, so the right answer is, drum roll, number 4. I think all of you guys got that one right. Good job. Yeah, now urinary frequency and urgency is a common sign among younger people. Once we get into older years, 60 and above, that sign may not actually be there. Often in the elderly, the first sign of a UTI is confusion. And this is kind of interesting because as we age, our bladder muscle tone decreases, the integrity of the valve at the bottom decreases. So we get a lot of urgency, we get a lot of frequency as a general rule of thumb in the elderly because their bladder just can't hold as much and they can't hold it for as long, so they're always going to the bathroom. So that actually might get missed. Confusion is often the number one sign that we see in the elderly. Audrey came in first, followed by Danica, Renee, and Catherine. Good job, guys. Very good. Number 7, which is a correct example of professional behavior? 1, being on time for shifts. 2, accepting gifts. 3, talking about coworkers. Or 4, talking about work on social media. So which is a correct example of professional behavior? 1, being on time for shifts. 2, accepting gifts. 3, talking about coworkers. Or 4, talking about work on social media. So I talked about professionalism in yesterday's class. Those of you who caught it on the live stream, you learned about how our professionalism can actually impact our overall pay as an industry. So it pays to know what a good professional behavior is. Being on time for shifts, absolutely. You guys all got this one right. We as CNAs should not be accepting gifts, and there's a lot of reasons for this. I'm actually going to do a lesson on this shortly, but this sets up a power dynamic that is negative. So if you accept a gift from a patient and somebody else on the care team doesn't get one, they may treat the patient differently. Or if you accept a gift from a patient, the patient may expect different treatment as a result of that gift. So be careful. Everybody should be treating the patient equally, and the patient should receive equal care from everybody. Gifts interfere with that. Nothing on social media. Your job does not exist when it comes to social media. Audrey came in first, followed by Danica, R.A., and Chrissy. Good job. Number 8. What is the first step in donning PPE? 1, gloves. 2, gown. 3, mask. Or 4, eyewear. What is the first step in donning PPE, personal protective equipment? 1, gloves. 2, gown. 3, mask. 4, eyewear. What do you guys think? What is the first step in donning PPE? Now, this is a hard question. I know it's hard. It's our halfway point. This is a hard question, and if you don't know the answer to this, not only is it going to show up on the state exam, but not knowing the answer to this can put your future patients at risk. So we're going to talk about that. Go ahead and lock in your final answer. Gown is correct. Yes. Now, those of you who put gloves, and there's a lot of you on here, those of you who put gloves, that is not correct. Gloves are the last thing that goes on, because remember, the first thing our gloves should touch is our patient. So it's gown, mask, eyewear, gloves. That's how PPE is put on. Donning means to put on. You need to know this because as you care for patients in a clinical setting, if you have a patient in isolation, you need to know the proper sequence to put these on. Taking them off, there's a sequence to that too, which helps prevent the spread of infection. So super important that we know that. Catherine came in first, followed by Danica, Anthea, and Chiefs. Vanessa. All right, number 9. A resident complains of hunger. What is the CNA's first action? 1, remind them of meal times. 2, report it to the nurse. 3, ask him what he would like. Or 4, give them a candy bar. So a resident complains of hunger. What is the CNA's first action? 1, remind them of meal times. 2, report it to the nurse. 3, ask him what he would like. Or 4, give them a candy bar. What do we want to do here? This is a hard question, isn't it? There's a lot of variables here. This is, again, a learning opportunity for us. And again, I'm going to pause this when we get to the answer because I want to talk to you guys about this real quick. All right, the right answer is to report it to the nurse. Now, this is kind of this is one of those situations that you are likely to read into the question. When you're taking a test, specifically a state exam, you have to look at that question as it stands alone. You cannot add anything into it. You cannot take anything away from it. That question is all the information you have about this patient. So if we look at this question, it says a resident complains of hunger. What is the CNA's action? We have no further information on this. Is it safe to give this patient food? Well, if we don't know anything more about this patient, if that is all we know, then no, it is not safe to give this patient anything. Because the patient might be in PO, or the patient might be on a specific diet, or hunger might indicate a failure of therapy, or hunger might indicate the success of therapy. Because this is all we know is a resident complains of hunger, and we know nothing more than that, then we have to report that on to the nurse. And that's what makes 2 the correct answer. So Renee came in first, followed by Audrey, R.A., and Sheila. Good job, guys. Question 10. A fall occurs. The CNA should, 1, help the resident up. 2, assess the patient for injuries. 3, look for tripping hazards. Or 4, call the nurse and stay with the resident. So a fall occurs. The CNA should, 1, help the resident up. 2, assess the patient for injuries. 3, look for tripping hazards. Or 4, call the nurse and stay with the resident. What do you guys think? You've got about 15 seconds left. Go ahead and lock in your final answer. What do you guys think here? Yeah, you guys have been listening to me. I got to come up with some harder questions, I think. Yeah, the right answer here, absolutely. We're going to call the nurse and stay with the resident. It is not advisable to help somebody up. That is against most facility policies. We don't help patients up. Assessing for injuries is something that the nurse is going to do before we help the patient up. Looking for tripping hazards, it's too little too late. You should have done that before the patient walked. So that is not the right answer. And then calling the nurse and staying with the patient is the correct way to handle this. And you don't want to leave the patient to go get the nurse. We need to call the nurse. And this is one of the benefits of having phones on you at all times. So Audrey came in first, followed by Renee, Danica, and R.A. Good job, guys. All right. Question number 11. A resident refuses care. What should the CNA do? 1, notify the nurse. 2, notify the family. 3, notify the doctor. Or 4, notify other CNAs. So a resident refuses care. What should the CNA do? 1, notify the nurse. 2, notify the family. 3, notify the doctor. Or 4, notify other CNAs. This is actually a really good test question. So 15 seconds left. Go ahead and lock in your final answer. Yeah, a lot of times during the test, you'll have a question that looks like this, where the start of all the answers is the same word. And it's designed to confuse you. That's what it's designed to do. to find out your role. So yeah, we're going to notify the nurse. That's our role. As a CNA, that's the only person we should be notifying. We, in our role, do not notify the family. That's up to the nurse. We don't notify the doctor. That's up to the nurse. And we don't notify other CNAs because that has no bearing on anything. You were assigned to do the task. The patient refused. You telling other CNAs isn't going to affect the outcome at all. So notifying the nurse is the right answer here. Now, some of you probably picked number 4 because of shift report, but that's not what this question is asking. This is asking, when the resident refuses care, what do we do? And we notify the nurse. So Renee came in first, followed by Audrey, Danieka, and Catherine. Good job. Question number 12. What should the CNA do before feeding a resident? 1, give them water. 2, check the care plan. 3, thicken their liquids. Or 4, document their intake. So what should the CNA do before feeding a resident? 1, give them water. 2, check the care plan. 3, thicken their liquids. Or 4, document their intake. Now, I can see who has listened to me in my lessons. By the way, you're answering this. Yeah, you guys are giving me information. Got about 10 seconds left. Go ahead and lock in your final answer. Lock in your final answer. Yes, Renee. Good job. Yeah, we're going to check care plan. Absolutely, 100%. Those of you who answered number 1 here, you were thinking about the skill, right? But what comes before the skill? Always the care plan. The care plan tells us what to do in that skill. It tells us the diet the patient should be on, what type of food they should have, pureed or finger foods or whatever. And it tells us whether the patient needs to be fed. So this is a great example of not reading all of the answers, reading the first answer, thinking it's right, and picking it. And again, I told you about that earlier. This is a trick that they use on the state exam. Always check the care plan first for every skill. Renee came in first, followed by Audrey, Danica, and R.A. Good job, guys. I know that was a tough one. Number 13. Before providing perineal care, the CNA should first, 1, close the curtain, 2, lower the bed, 3, remove the brief, or 4, apply gloves. So before providing perineal care, the CNA should first, 1, close the curtain, 2, lower the bed, 3, remove the brief, or 4, apply gloves. So this is asking for sequence. This is asking for sequence. Yeah, Blue, I know. All right, so you got 15 seconds left. Go ahead and lock in your final answer. You guys are doing great today. Great job. All right, 5 seconds left. What comes first? Closing the curtain is going to come first. And if you've listened to my lessons, you know that we do our opening. Knock, knock, knock. Hi, Mrs. Jones. My name is Patty. I'm here to do pericare. Is that okay? Close curtain, wash hands. Get your supplies, and then we're going to start the skill. And yes, we do need gloves for this. A lot of you guys put number 4. We do need gloves, but we don't put gloves on before we close that curtain and we wash our hands. You don't put gloves on before you lower the head of the bed, because everything you touch with those gloves is going to contaminate the gloves, and think about where those gloves are going. We want clean gloves for this. So you'd put your gloves on right before you start the skill. So Renee came in first, followed by Bridget, Catherine, and Sheila. Question number 14. Almost done, guys. 2 more to go. When measuring a radial pulse, the CNA should count for 1, 15 seconds and multiply by 4. 2, 30 seconds and multiply by 2. 3, 1 full minute. or 4, as long as directed on the care plan. So yeah, this is a hard one, guys. This is a hard one. Think about everything I've told you so far today. When measuring a radial pulse, the CNA should count for 1, 15 seconds and multiply by 4, 2, 30 seconds and multiply by 2, 3, 1 full minute, or 4, as long as indicated in the care plan. What do you guys think? Go ahead and lock in your final answer. You've got about 5 seconds left. If you've listened to me at all, as long as indicated in the care plan. The care plan is what's going to dictate the care for that patient. So for some patients, 15 seconds and multiply by 4 is perfectly okay. If the pulse is steady, if it's regular, 15 seconds, multiply that by 4 to get your minute reading, that's appropriate. 30 seconds and multiply by 2 might be on the care plan. Counting for 1 full minute might be on the care plan. It's individualized for that specific patient. So again, this is question number 3, where I buried the answer way far in the answer choices, and I want you to make sure you're reading all the answer choices before you decide what you want to pick. So Sheila came in first, followed by Brittany, Adlin, and Renee. Last question, guys. After cleaning a resident's dentures, the CNA should 1, leave them in the sink, 2, wrap them in paper towels, 3, store them in a denture cup, or 4, place them in a drawer. Yeah, this came from yesterday's lesson as well. This is an easy one. After cleaning a resident's dentures, the CNA should 1, leave them in the sink, 2, wrap them in paper towels, 3, store them in a denture cup, or 4, place them in a drawer. Go ahead and lock in your final answer. You've got about 20 seconds left. Yeah, I'm going to end you on an easy one. This was a hard one today, wasn't it? Yeah. I hope you learned a few things, though, about how to slow down on the state exam and read all the answer choices. The right answer here is to store them in a denture cup, sure. And most of you guys got this one correct. This is kind of a no-brainer. This is what every program teaches, every textbook teaches. We're going to store those dentures in the denture cup. Never leave dentures in a sink. We don't wrap them in paper towels because they need to be in water. And we don't just place them in a drawer because your patient may need them. They've got to be able to access them. So we're going to put them in a denture cup in water. So Blue says don't drop them. Yes, that's right. They're super expensive. Yeah, very good. All right, did you guys enjoy today? Oh, let's see what the scores were for this question. Hold on. I'm sorry, I got ahead of myself. Okay, the right scores today, or for this one, was Audrey, Danica, Renee, and Catherine. So let's see our overall scores for the entire quiz. Renee came in first. Congratulations, Renee. You get a t-shirt. Audrey, you came in second. You're going to get a card game. And Danica, congratulations. You're going to get some motivational gifts. So I'm super proud of all of you guys. So let's, first place, this is going to be Renee. And this is my email. Guys, you're going to send me an email to 4YourCNA@gmail.com. So first place is going to get the t-shirt. Second place is going to get the card game, and third place will get the badge holder and some inspirational gifts. So let me go back real quick to our prizes for just a second so we can, let me get ready. So first place, Renee, you get to choose from CNA Care Crew, the class t-shirt, cheat shirt, Become Inspire Care, or Called to Care. So those are the t-shirts that you are going to get to choose from. Second place, you're going to get the card game. Third place, you're going to get some motivational gifts. So congratulations to all of you. Did this help you guys kind of understand how the test questions are going to be worded, how the answer choices are going to be presented to you. And sometimes remember that the order of those answer choices are done on purpose to really make sure that you truly understand your role. So make sure you're reading all 4 of those answer choices before you make your decision, because the first one might look right, but it's not the best right. There's something even better coming up. So look at all 4 of those answer choices before you make your decision. Remember, for the test, you've got plenty of time. You've got 90 minutes to answer 60 questions. There's plenty of time to slow down and read all of those answer choices. I hope this helped you guys. I hope you had some fun here. This is the most fun thing I do each month, is come on here and do the game show with you. And I have a lot of fun making these questions up, and I do it in a very specific way to make sure that you're prepared for the test. If you have a chance, make sure you tune into our classroom live stream. If you learned something today, then chances are I probably have something more that I can teach you in our classroom live stream, and it's free. Everybody is welcome. So you can find that on flcnatraining.com. So I'll put that in the chat for you. So flcnatraining.com. You can tune into our live stream. You can watch the replays, and there's free worksheets on there for you as well. So it's all there for you. We'd love to have you join us on one of our classroom live streams. I hope this helped you guys. Happy CNA week to everybody who is a CNA. I'm super proud of all of you guys that are in the industry, and those of you who want to enter the industry, and we celebrate you as well. So happy CNA week to all. That applies. And Krusty asks, would you happen to know the required pass mark in Texas, what I need to pass? For the written test, that's actually not published. They don't give you a specific score, and that's because each category is going to be graded independently. So keep that in mind, that they don't publish the exact score. Okay, I'm on a panel here in Washington State to create continuing education course on helping residents and clients not fall for scams. Oh, that's a great course, Blue. That's a great course. Yeah, I send you lots of props for doing that. Okay, guys, I'm going to go ahead and sign off and let you guys get back to your wonderful Tuesday. And thank you so much for hanging out with me. And we'll do this again on the first Tuesday of July, which I think is right around the 4th. Yeah. So yeah, I can't believe this year is half over. Where did it go? I am just amazed at how fast time is flying. I'm working on a new video, so Denture Care will be up sometime in the next week, the new version of Denture Care. So make sure you tune into that when we go live. We'd love to have your input on what you think of the new video. Yeah, Blue, I'll work on that. All right, guys, I'll see you next time. Until then, happy caregiving. Bye.